therapists function within the oral health team. They focus on curative care, such as patient examination, diagnosis of common oral diseases, taking of x-rays, tooth extractions on both deciduous teeth and adult teeth under local anesthesia, restorations on teeth, and treating gum disease through scaling and polishing and root planing. Training encompasses the acquisition of preclinical and clinical skills relevant to the scope of practice, the patient or client care in clinical and community settings. Students receive their training in various clinical and community platforms as arranged by our discipline. In the third year of study, students spend most of their time working on patients in the different clinical disciplines of dentistry, which is all within the scope of dental therapy. Oral hygienists, however, focus on preventative care, such as oral health education and promotion through patient education at the chairside and at a community levels. They also perform curative care, such as treating gum disease through scaling and polishing and root planing under local anesthesia, treating hypersensitive teeth and performing tooth whitening procedures. They can also work closely with dental specialists, such as an orthodontist, in placing the brackets for braces. Both dental therapists and oral hygienists can work in the public sector as well as in private practice, and can perform all functions within the scope of primary and secondary levels of prevention in dentistry. Both programs are a duration of 3 years. The admission requirement is a national certificate with English and life orientation at level 4 and maths and life sciences at level 3. We will only consider applications if your choice is 1, 2 or 3 only, and you require points between 30 and 48.